All right, everyone, please welcome our panel with the big hands, okay?
All righty, guys. So this is a meat of the event here, that what we're going to be doing. So before we start, I'm just going to go over a quick thing here about all you guys in D4. How many D4s here? Awesome. So as a D4 student, there's a lot going on in our minds. And many times we are thinking about how do we get started? What do we look for? Where to go? There's going to be tons and tons of questions. Just one word of advice. Know exactly what you truly want and what are you looking for, and just go after it. Opportunities will present. Okay? Now, with that being said, I'm going to go ahead and call my dental associates. The panel discussion is going to begin now. So come on up, guys. All right, so I'm going to pass the mic around, I guess. Do me a favor, guys. Just a brief intro, 1 to 2 minutes, where you are, what you're doing, and something a little bit about yourself.
How's it going, everyone? I'm Dr. Alex Shore. I began with Secure Dental in 2019. I went to University of Michigan School of Dentistry, so I'm not your typical Secure Dental recruit by any means, but I'm happy to be here today and talk to you about what it's kind of done for me and how it's kind of catapulted my dental career and all the things that I was able to accomplish in a short period of time. I now own my own dental office in the south suburbs of Chicago, and a lot of what I take in and a lot of what I've been able to do is because of the experience I gained very quickly and very efficiently with Secure Dental. So happy to be here and looking forward to answering all your questions.
My name is Mike Rue. I graduated from NYU in 2018, and I've been with Secure since. And it's been a pretty good journey. I'm continuing to learn. He's more than passionate to learn more than myself. So my experience has been great with Secure. So I'm really happy to be here to share some of my experiences with you, if it applies to you. So I'm looking forward to it.
Hi, I'm Seol Choi. I graduated NYU in the year of 2022, and I started working right away at Secure Dental in Illinois. I'm relatively a newly graduate compared to these people. So if you have any questions how to survive as a newly grad, just feel free to do so.
Hello, everyone. My name is Daniel Kang. I graduated from NYU in 2022, and now I'm practicing in the Secure Dental Davenport office. And even though it has been only a year and a half, I've been doing implants and things complicated stuff, and only because the company supports it, which is pretty cool on. So now I'm here to share some of my tips and experience. Thank you.
Hi, I'm Nazis Jaffrey, and me and Dr. Liu, we work together. 35 years of a very amazing relationship. I'm very proud to be here with an amazing group of people that work for us. Just amazing, every skill set that we have. We love mentoring and working on the floor with our associates. So it's just mind-boggling how from being sitting in here and sitting up here, the life experiences that they had. We really wanted to bring the real life experience that they had. And hopefully you guys have tons of questions for us. It's a very open forum. Bring in those questions, because there was one time I had those questions besides the free lunch. We are here. We are here for value. So please be open about it.
And no, none of these guys were forced to come here. All right, guys, so let's start with question number one. Now, these are questions that's coming up from you guys and from many of our past experiences, like what is a new grad looking for? It doesn't only have to be D4. It can also be D3, D2, because those are the kind of conversations you need to have with yourself of what's going to look like post-graduation. We spend our hard-earned time, money, and resources getting into dental school. Now, how do we make the most out of it? And it all depends and starts with how much work are you willing to put in, okay? So with that being said, I'm gonna start with the first question, and we can go in the same order. How important has mentorship been since school?
Well, I think a lot of where I was sitting where you were, is how am I going to do dentistry without killing somebody? That was like probably like first on my head. And then when you graduate, you're like, well, I know all this stuff, but how do I make sense of it? How do I take a filling that doesn't last 3 hours? Or how do I do these things effectively and kind of grow? So where I was when I found Secure Dental was I worked for a group practice in Michigan, where I'm from. And I was just really kind of not getting it. They didn't care about me. They kind of just made me check all the hygiene exams, and they kind of just made me do a couple fillings over the course of 6 hours. And I just kind of was fed up, and I didn't feel like I was growing, and I didn't feel like, well, what I now know to be true is I didn't have a mentor. They just kind of threw me in, and I was just a piece of their puzzle. So when I applied on LinkedIn for Dr. Lou, he called me 8 minutes later. I still remember it. And it was just kind of one of those things where we went out, I saw the place, I visited, and I realized having somebody who actually cares is a very, very big first step, but also, having someone who's going to push you to be better every day and challenge you on what you think is true and kind of reassure you that you can always do a little more, you can always be a little better is key. So with this group particularly, just kind of refining the general dentistry skill set that you graduate with and making you very fast, very efficient, and very successful with it. And then once you expand on that, it becomes, let's do some aligner work, let's do some implant work, let's put you through an endo course, and the kind of, opens each door. And I could say definitely that the people sitting next to me today can all say the same thing. It's like you start one place, and before you know it, you're doing molar root canals and overdentures and implants, and you're just kind of looking back and wondering, I can't believe that started. But how it started was all because of the mentors, right? And they do a very good job making sure that you understand, that you're comfortable, and most importantly, that you're growing every single day. So that's just kind of my experience and kind of how that went down.
It's not fun sitting next to you, man. I should just sit in the middle. For me, mentorship was everything looking back. I truly believe, it's the absolute factor on what kind of dentist you become. Because it's a great profession. I would have to say it's a non-stop learning experience. I would have to say I've learned more in the last 6 years after I graduated than I ever did in the 4 years in dental school. So it's a learning process. We continue to learn things. We've heard it from Dr. Park's lecture too. He's using products that are coming out. He's testing it out. And he's still learning. Dr. Lou, Joffrey, we're constantly learning. When we make mistakes, and we learn from our mistakes. So I truly believe that it's really important who you start working for and who you choose to be a mentor to learn from, because they will ultimately shape and form the kind of dentist you become. At the very least, I would have to say. And then I was very fortunate enough to meet Dr. Lou and Joffrey. I think he is now too, right? Who helped me, far exceed the level of clinical skills that I thought I would have by year 6 out of school. So definitely make sure that you learn from the right people.
So the mentorship's been extremely important for me. The right mentorship drives you to where you want to be. So when I was back in dental school, I was so confident that I'm confident enough to provide care to my patients. But little did I know, the real dentistry was total different ball game. Like when you're in dental school, you're so used to treating one patient for an hour and a half to 2 hours, and you're so used to like referring them out to all the specialists. But after meeting Dr. Lou and Dr. Joffrey, they just mesmerized me. They do everything, almost everything in-house. So now I place implants, I do clear aligners, we treat sleep apnea. So it's very important that you meet the right mentors, and with the right mentorship, you can develop yourself better.
All right. So my idea of the mentorship is that once you guys graduate, you guys are gonna practice in the real world, and you're gonna have a lot of the trial and errors. Some of them will be heartbreaking. Some of them will take a lot of time, but they will be worth it. You'll learn a lot from it. But what I think is that if you can find someone who's been through those trial and errors, and if you can learn from that person, you can technically bypass all those heartbreaking, time-consuming, all those efforts, and it's pretty much something that's logical and reasonable. And in terms of that, the mentorship has been very, very important for me. I was able to excel at a faster rate only because I had the mentorship and who's told me about all those lessons that they learned from the try and error so that I could just bypass that.
So mentorship for me, the idea started is when I graduated and I was working in an office, and Dr. Liu was working like 3 hours away in another office. There were like 3 other dentists in that particular dental clinic, and I was the youngest and the newest, with the newest dental assistant all the way in the back of the room. Third day, I got a canine root canal post-core crown. I thought I could do it because I did it on a sim lab. I graduated, I got the license, I did my nerve. I thought I could do it. I did the root canal, that was fine. I got stuck in that darn post-core. I could not get in, and I was so nervous. And I kept calling him because the other 3 associates that were working there were very, very high producers, and they were not mentors. They were producers for the office. So it was very hard. It was nerve-wracking. I was sweating bullets. It took me 3 hours to do that one canine post-core. And I cannot, I still remember that feeling. And that day onwards, I told Dr. Liu that I want to make sure that this experience doesn't happen to people who come to our office. I want to make sure that we're right there mentoring them, helping them, because dental school doesn't teach us everything, right? Dental school doesn't teach us those tiny experiences that we experience right in that op room. It's only you and the patient, and how the mindset has to change, and how you have to come out of the comfort zone to ask questions, to ask the right questions. Sometimes we just very introvert and we keep it to ourselves, and it becomes very emotional and personal. And we want to make sure that besides clinical dentistry, how we support our associates to come out of those emotional attachments with the patients and the procedures. So that's how our mentorship is.
That's great. You know, we have multiple locations and we can't be everywhere all the time. One of those things that we do is we do it remotely. Remotely meaning all our software is cloud-based. And basically, if any of them call, they just send a quick text. We open up my laptop or my iPad, and I can just go right into the chart and see what's going on. So that's where majority of our clinical setting happens. And I do like to make rounds myself, and I'm still practicing, by the way. I'm not somebody who's sitting behind a desk and just doing admin work, even though that is a huge part. But because I have a good partner, my wife there, so she does the admin stuff, like the marketing, all that good stuff there, but I'm still in the trenches, like I said before, right? So next question here is, what was the most impactful experience you had since graduating dental school?
I guess for me, the most impactful experience I had was really finding a group that allowed me to grow. I think that it's kind of like what Doc said earlier today. It's what you do in the past that sets your table for the future, and you have to look back and constantly evaluate that and say, am I making the right choice right now that's going to set me up for success later? And to be with a group that was allowing me to take on these cases and say, hey, it's your case, not our case. We'll be here if you need us, but it's on you to make the call and do the work you want to do and what you're comfortable with. Early on, that's a little bit of a big burden, but as you do more of them, you start to understand, your strengths and weaknesses and kind of go on from there. So I think the most impactful thing for me is it was self-confidence, gaining it, and being in a place that will allow me to gain it and allow me to kind of have trial and error while I do it. So I guess the takeaway for me would be, never be afraid to push yourself and grow, because it's happened to everyone in this room. You're going to do things that work and don't work, but you won't know what works for you until you try. So that's kind of what experience drove me.
Impact for me, I think, was mistakes, right? Those what I call sweat down, drop, down my cracks, I call it, right? I don't know if you Gen Z's look at the Lil Jon reference, but we've all been through it. We go through it every day, and I know you guys go through it every day, in the sim lab and those of you in the clinic with patients. But just learning from your mistakes, right? I don't think there's a better educator than your own mistakes and learning from it. And it's whether you continue to, try to grow and get better at the mistakes that you've made, rather than breaking from it and stay away from it, right? So the courage to keep pushing you to get through, like Dr. Shore said, I think ultimately will make you a better person and get better at it, right? That's really the only way to get better at it, because the only way to get better at it is if you suck at it in the beginning. And we all suck at everything that we do in the beginning for the first time. So have some courage. Just keep grinding, keep going at it, and just try to do better next time. So that's my motto, right? Going in, I'll look at some of the work that I did first out of school, like 5-6 years ago. I'm like, oh, I didn't do that. That's not mine, right? Like, and you all have that experience. So, but it's not about going back and looking at it, but like, oh, like, oh, I sucked, right? But it's about getting better and doing better than who you were yesterday. So that's really it for me. Because ultimately you want to make less mistakes and go moving forward, right? And that's how you build confidence. So that's my kind of go-to for my daily mindset. So
I'm going to be very specific to answer this question. My impactful experience was the implant course that I had with Secure Dental. It was because I was never exposed to implant when I was back in dental school. I didn't take any honors. I didn't really care about implants. I didn't expect myself to be placing implant right after graduation. So it was like 3 to 4 day courses where we had perios and pros. They came over to one of our offices. They taught us how to select specific cases and also how to place an implant from A to Z. So I think that experience really, opened up the door to implantology, but also boosted my confidence level. And I slowly started placing implant under the supervision of Dr. Liu and Dr. Joffrey. And now I'm very confident enough to recommend implant to my patients now. I don't have to refer them. And they're very happy that they don't have to go somewhere else. So, yeah.
All right. So my most impactful day after the graduation was my first day of the work. During the school, I wasn't the most passionate student. I slacked off a lot. I probably took out like 12 teeth in total when I was in school. Also, the COVID was there. So my first day, I went into the clinic, and I had this patient wanting to have the full mouth extraction, 24 of them, and 12 of them were surgical. And I was looking at the mirror, just telling that I can do it. I jumped in. I spent 3 hours taking out those teeth, suturing, sweating bullets, thinking, what have I got myself into? But that was the day that I realized that I am now in the real field. So that was the most impactful event.
Well, my most impactful events happen almost every day with these guys. Just watching them come out from the scared, afraid student mindset into a clinician's mindset, and how they are coming across everyday patient issues and treatment failures. It's the failures, how you are attempting those failures, that is change in mindset, and how you're dealing with it. Everybody can pick up a handpiece right now in this clinic, in this group, and do a class 2. That's fine. But when that class 2 fails, or when that patient comes back with pain, and how you evaluate it and how you make the patient happy and comfortable is where you shine. right? So that is impact. What kind of an impact are you putting on your team? They're watching you, the dental assistant that's watching you, and how you're handling that patient, that's impact, right? And these guys do it every day.
Awesome, love it. So one takeaway everyone has, and I think everyone should take away is, regardless of how good of a dentist you are or how good of a surgeon you are, you will always, always have some sort of complication, right? You will always have something that goes south, that goes north, goes in all directions. The key is, how do you manage it afterwards, right? My biggest impactful moment after graduation was fixing all those errors and complications, right? I mean, it was one of those things where I was not up for the task because we had like 4 locations and I was just still working at chairside. Now, when a patient has a complaint, what do you do? Financial, time spent, everything is like draining at that time. So know one thing there. Do not run away from complications. You guys will have them. Face it, take the bull by the horn, and tackle it. And that will be your biggest learning opportunity, because that has been for me and for everybody over here. So even in clinics, I know you guys got faculties you can run to, right? But start learning to come up with solutions. Anytime there's a complication, come up with 3 different kind of solutions. What are you going to do? How are you going to manage it? What will be the outcome? That is the key for you guys to become more confident and more successful, is by investing in yourself. All right? All right, describe some of the challenges that you experienced right before graduation and then right after graduation. So let's start with before graduation.
Before graduation, I think I had the same problem as most people. I didn't have all my test cases lined up, or I don't know what it's called here. And boards, yeah, scrambling, finding patients, trying to get my last minute credits. And finding a job, I didn't have that one exactly lined up. So I spent the first couple weeks after dental school hunting down jobs, going to interviews. After was kind of that finding where I fit. I thought you said before and after. Yeah, and after. Yeah. Come on, man. After.
Yeah, we can do both. We can do both.
What do you want? We want me to do before? Okay. After, I think my biggest problem was finding where I fit. I was very frustrated, and I really never thought I was going to leave the state of Michigan in general, but my frustrations with not getting the experience, not getting the exposure that I wanted, and it just kind of drove me to the next thing, which was here. So that kind of, like, never lose your passion moment. It's kind of like, don't just go take the first job you get and put your head down and not be fulfilled. You still want to do something that gives you joy in what you do. Don't forget why you became a dentist. And when I met here, in Peoria at the time, I realized like something like that is what I was looking for right away. It was something I was looking to be. And if I really, really wanted to be the best dentist and the best person I could be and help the most people I can, I should take this opportunity. So the struggle oftentimes, like before, while you're in dental school, it's like, I got to finish, I got to make sure everything's in line and I can walk across the stage. While you're after, your paradigm kind of will shift into, what am I going to do for me? Is this working for me? Do I need to go back to school? Do I want to do GPR? Do I want to specialize? Or do I just need to change up the pace a little bit, change the state? It's all going to come down to what you're looking for and who you are. So those were kind of my before and after of dental school.
For me, I guess the best way to put it is to ask yourselves, right? Whether you're D4, D3, or D2, D1, the situation that you're in and the task that you're faced with right now, right? Like Dr. Lou said during the intro, we're no different, right? We came from the same thing pretty much. So we know what it feels like to be sitting right there, right? Did you guys take the boards yet, D4s? Is that coming up? The CCA? Yeah, you did? Oh, okay. So you're done? All of you make it? Okay. All right. Anyway, okay. So if you're done with it, then fine. But right, it's like, if let's say like a month or two ago, you're worried about the boards, obviously, right? Finding the patients, right? If you're D3, you gotta like give up your patients to D4s, right? Is that still a thing, right? Where you have your own requirements to meet, right? So stuff like that. So just focus on what you have, I would say. And then I was worrying about the same thing too, right? After the board, it's like where I'm going to start working, and all these options, residency, right, GPR, specialty, and all that. But just keep asking yourself, and I think answering that question for yourself is really the way to go. So to pursue what you like, right, at the end of the day. And I think after, for me, was the level of incompetence, right? Like coming out of school, graduating D4, I'm just like, I don't think I know anything. I don't think I'm prepared for the real world. And I still remember my very first patient that I went in to do an exam, and like it's just, but I stuck to it. The more I did, the more patients I saw, the more comfortable I was. So just keep pushing. You just have to do it one at a time. Really, you can't really look 5-10 years in the past, in the future. So just as long as you focus on what you have, the tasks that you have on hand, on the table, I think you guys will be okay.
So pretty much the same as Dr. Ru. Before graduation was figuring out what I really wanted to do. I wasn't sure if I wanted to do GPR or specialize or go straight into work. So my recommendation is to just spend some time and think about yourself and figure out what kind of person you are. Are you a type of person who wants to do one single thing for the rest of your life, or you want to try the variety of dentistries? I loved every aspect of dentistry. That's why I went straight to work. And you also want to talk to your upper classmates too. Do some research. That's how I met Dr. Liu, Dr. Joffrey, and learned about Secure Dental. You guys been studying for this long to become a dentist. Why not a little more to have a better life, right? After graduation was also similar to Dr. Ru. I don't know about you guys, but I never had a surgical extraction when I was in dental school. Removing like even 1 millimeter of bone sounded crazy to me. So after graduation, after joining Secure Dental, I started doing a little bit of surgical extractions. And I still remember that one patient, it took me, he said 3 hours for the whole teeth, right? It took me 3 hours for one tooth. And I almost cried. And well, I didn't give up. They didn't give up on me. So the more you get to try, the more you get to experience, you get better at it. Yep.
So the biggest challenge that I had when I was before the graduation was that I had my goal. My goal was to become a super GP. That's something that I really wanted to do. But my real question was, how am I going to get there? Sure, everyone wants to become awesome, but you have to have some clear idea about the realistic strategies about how to get to that level, which course you need to take after graduation, which the time frame, you need to have those numbers set. Otherwise, the time is going to just pass by. So, however, as a student, it was really hard for me to find out about those information. So, and when I was back in the school, it was COVID, so we didn't have events like this. So I had to just pay the money and go to the different seminars by myself to try to find out about those kind of information. So that was the hardest thing. And right after the graduation, and of course, the whole school was a challenge. But right after the graduation, the biggest challenge was to find the right way for me. In the field, there will be a lot of the techniques, a lot of tools, a lot of different methods of the different dentistry. But then you have to figure out by yourself which method is good for you, which tool that you want to use. And one of the best way to find out those methods, the suiting methods, would be just to try them all. There's no easy way. You just gotta try them all, and you gotta find the right way for it. But trying the new things is time to time it's scary, it's fearful, but it's something that you have to go through. So that's something that I had to go through. So that was the biggest challenge right after the graduation.
Challenges before graduation was, how am I going to pay that loan off? Who's going to hire me? Am I going to be able to produce that much? And that is a real challenge that comes to our minds at night, and you think about it. So really, like how these guys are saying, look into yourself and see what your priorities are. Everybody has different kind of priorities. Somebody wants to do everything. Somebody wants to just do maybe implant surgeries. So be very clear and focused in what you want to be, not what your friends want you to be, not what the outside people want you to be. Because eventually in that room, it's you and the handpiece and that patient, right? So be very, very focused in what you want and how you want that handpiece to work for you, to feed you and your family. And after graduation, it's, I think, the same thing. It doesn't change because you still have loans for different things. Right now, we have a few more offices coming in and we have kind of different challenges. So loan never leaves us, regardless if it's like student loan, house loan, car loan, whatever. So yeah, just prioritize it. Don't get scared of it. And if your heart and mind is focused, jump on it, do it.
Yeah, later on, we're going to talk a little bit about debt, loans, finance, and all that stuff there. But do understand one thing, though. There are good debt and bad debt, right? You have to understand, you have to know the differentiation. Debt is good, depending on what you're using it for. And we will bring Dr. Mary Kang. We're going to talk about investment in real estate, and that is when we use debt as leverage. So there's going to be a lot of things about that you guys will be exposed for the first time. And just soak it all in. You don't have to act right now, but just understand there are two kinds of debts. Gambling debt, of course, that's bad. Credit card debts, those are bad. You just need to know your priorities, what you're trying to achieve in life. All right, so I'm going to skip to this one other question here. Some of the job opportunities that you guys had before graduation, what, like some of the audience wants to know, like, what were you looking for in those, and basically, what's your opinion, what's your take on it with these different opportunities you were presented with? Yeah, dental jobs.
So I had a few things on the table to pick from. The first one would have been a federally qualified health position, which I'm not sure about what this state's stuff is, but that's kind of like you go work in a low-income clinic. They offer 4 years. They pay for your school. A lot of times I felt like those types of positions are hard to get out of once you're in them, and you're kind of doing very, I guess, relatively unfulfilling work. Not the stuff you'd want to do, the stuff you're kind of told to do. So that was option one. Option two was a very corporate type of dentistry for, I believe I interviewed at Aspen, and I interviewed at Great Expressions. And then, those were kind of more of the base pay. You're going to get a lot of work. You're going to be on a quote unquote bonus, which I don't really think that was a bonus, but so that was another option. And then the third option was going around to private offices, seeing if somebody was brave enough to take me on. And I found out the hard way that kind of wasn't going to be a very reasonable option for someone with no experience. So that's kind of the thing where you graduate, you don't have experience, and you want to go with the place that's going to give you the best. The options that are presented to you easily are ones that are going to be very, very high volume and very high paced. And it's on you to kind of look and ask the questions of, how many patients am I seeing a day? What types of procedures can I do? What types of procedures am I not allowed to do? What's an average day like? What's an average week like? These are the things that you'll ask as you go on to these things a little more. And then the last option I had was a DSO, otherwise known as like a private, kind of like a hybrid, like a private practice that runs with high volume and takes a lot of insurance and has a lot of flexibility. And that is where I landed. It's kind of the best of both worlds. So those were kind of like what was on the table for me when I had the ability to pick what I was going to do.
As far as job opportunities were concerned, just like many of you that are sitting here, I was worried about the same thing. I was most anxious about job, right? Literally securing a job and where to work, right? But he back then he did a lot of similar things when I was in school as well. But when I was in school, he was actually able to do it, on site. I met him. I also had a blessing. Because my brother started working for him a couple of years ahead of me, so I've known them, so that was good. So it was a little easier for me, but I wanted to make sure I had my job secured before like even the boards, right? So I was pretty blessed with that. But like Dr. Shore said, you have to ask a lot of questions, right? And you have to know what's right for you and what kind of environment you want to work in. And I know you don't know that yet, right? But so to kind of narrow things down, I think the most important factor is procedures and patients, right? Because we're dentists and you want to get better as a dentist and a clinician. So you want to find out, the patient pool and then the number of procedures that they allow you to do and then what they do, right? So they'll kind of be the basis for where you decide to go and room to grow as a clinician. So I think you just have to ask a lot of questions, right? And some of the things that he said, like the patient pool is important, what kind of procedures, whether, the digital's a thing now, right? So you want to make sure they're doing digital things versus the analog. So you want to be with somebody where you can learn more things and possibly get what you can out of. And if obviously I was fortunate enough to stay with one company for all this time, but not all of you will, right? You will run into some crappy owners and clinics. So it's not something that you can control, right? But as long as you can get out, any positives, and as long as you apply that to your next and continue to, grow and get better, I think you guys will be in a safe place.
So I had job offers from multiple DSOs and some private offices in LA, but the biggest factor that allowed me to choose Secure Dental was the mentorship, definitely. The other offices, you were just on your own. There was no one to help you, no one to mentor you. But Secure Dental, we had Dr. Joffrey and Dr. Liu, who was always there. And also they provided this friendly environment where you can ask if you have any questions to other doctors and also other specialists. So I think the mentorship is the most important part for me. The second one would be the opportunities and the resources where you can learn and develop as a better dentist. Like you want to learn implant, are they offering mentorship or implant courses where you can go and take? Or if you want to learn about clear aligners, are they allowing you to and actually do it too? So those are the two things that I would look into.
Okay, so for me, a few months before the graduation, I had a lot of the offers. I had the one from the New Jersey, I had the one at the Aspen, Dental Dreams, and different places. And they all have the pros and cons. The ones at the New Jersey, near the city areas, they have a very nice work and life balance. And the places like the Aspen Dental or those big DSOs, they give you a lot of signing bonuses, which is very good too. Sounds good. But my goal that I had when I was in the school was to become a super GP and retire as soon as possible. Because why not, right? But if you want to do that, in order to become a super GP who knows how to do every aspect of the dental field, I wanted in order to retire as soon as possible, I wanted to just cramp in, wanted to learn as much as possible. They say that, like some places, they give you like 40 grand for the signing bonus. But if you think about it, if you know how to do those implants or fixed arch cases, it's like you do 1 or 2 cases and you get like 40 grand right away. I mean, if you think about it, if within those first 3 years, if you can master those, after a couple years, I mean, all those signing bonuses, they're not going to matter much. So my focus of the looking for the job was the experience, not the other factors. So yeah.
That's amazing. That's pretty cool. I think one of the questions that you want to have in your mind while you're asking questions is patient base, what kind of procedures. So when the patient comes in the office, they don't have anything written on the forehead that they're going to need an implant, that they're going to need a root canal. Usually they come in with a pain in the tooth, and either they want a filling or they'll say, I want a crown, right? It is what you treatment plan it as and what your diagnostic skills are is going to turn it out. So somebody can do a filling and just get $190, let's say, on that tooth. But somebody who's really good in diagnosis and they know that it might turn into a root canal, they might just do a root canal on it and get more money, and then also for a crown. Somebody who is an oral surgeon, they're like, oh, who's going to do a root canal? Let me just extract it and do an implant. So that one tooth with that one kind of lesion in it can turn into so many different things. It depends on how your mindset is working. But you also want to ask a very key question is how transparent is that company or is that owner in their KPIs? KPIs is the number, and it is the way they do the production and the collections in the office, right? So what are you getting paid on? Very important. There are a lot of different ways and a lot of internal softwares that each company uses, and you want to know about that. That is important. How are you getting paid on that production or on that patient? Is it collections? Is it production? Is it adjusted production? And our doctors here know that really well. It's very black and white with us. The system that we use, they can actually go in and see exactly what they made after the insurances pay and stuff. So that's really important. What you do with your handpiece is you, but how are you getting reimbursed is something that you want to know about. Okay.
Awesome. Well, with job opportunities, one thing we must all keep in mind, like, even though as much as lucrative these guys are making it seem secure, and I'll be honest with you up front, I'm not sugarcoating, okay? Secure dental is not for everybody because we really have this winning attitude and we have this mindset, like how do we go out there and there is no competition? And that is a kind of the belief and the mantra we work with. Because once we are out there, my whole job is to not only mentor you to become great dentists, but how do you go out there in the field and open up your own practice and kill it, all right? Because that is ultimately the motive for me. And a lot of times it does not sit well with many associates. The other thing that I'm really big on is collaboration. If you're not in for opening up your office, let's talk about what can we do with collaboration. And that is something in the works that I'm really diligently working hard on. How do we create more offices with implant centers? How do we provide more value? How do we go out there and let's take on the competition? So if you have that mindset of winning all the time, then this is the right place. If work-life balance is something which you're going to be more focused on, it may not be the right place. Because I would really push you to become great GPs, because in order for you to become really successful out there in paying your bills, like let's say you have your own office, and Dr. Shore can attest to that a little bit, you got to know where your skill set is. And when that burning question comes in, which you can't afford your bills because you were not able to produce, that is a very, very hard lesson. Okay? All right, let's continue. So what is your personal take on GPR?
So when I was a fourth year, I did apply to a few GPRs, but and Dr. King hit this one right on the head as far as how I thought about it. It's kind of, what's it worth to you to go through a fifth year of dental school? Or do you really feel, I asked myself, did I feel just as prepared as I did in year 4 as I will be at year 5 end, or will I be in the same spot? And chances are, I know everyone's different and some people want the extra exposure, but for me, I just was like, it's not going to work for me. Like I will still, if I leave at year 4, I leave at year 5 or 6 or 7, and I'm still a general dentist, I'm still a general dentist with 0 days of experience. That was my personal, look inside and see what it's in it for you. Now, I do have friends that did GPR and they got experience with sedation. They got experience with implant. They got experience with veneer, cosmetic, and there's tons of them, hospital-based dentistry that they're going to offer you. And the real key decision maker should be, if you go to these places and you do these things, are you going to take it with you and implement it with absolute intensity when you leave? You go learn sedation. Are you going to, day one, you open back, I'm a sedation dentist. That's what I do. Or are you just going to be like, I learned it and it didn't really work. Now you're really wasting time. So the key is going to be, what's the value of your time and what's the value of what you're doing to you? If you're just going to go do a GPR to do more fillings, I really think you should probably reconsider that. But if you're going to learn some very advanced things and have the ability to possibly implement that and increase your value to your community that you choose to serve or your practice that you choose to join, then I think it could be beneficial. But you do have to ask the right questions when you're picking your GPR. Is how many of your graduates go on and do whatever it is, sedation, or do I get the actual certification from coming here, or do I still have to go do more trainings and pay for more and do that? Because you may leave these places and be able to make just as much, if not more, in money, value, experience, growth in 1 year than you would with a year still being in school and taking out that additional loan while your other loans are accruing interest. So it has to be the right fit. And it has to be something you're really, really looking for if you think GPR or specialty or AEGD is worth it. And I'm not here saying that they're not worth it. It just has to be exactly what you're looking for. So that would be my take on that.
Cool. For me, I can't really comment on it too much, I guess, because I didn't do it, right? I didn't experience it myself, like he didn't. But what I want to say about it is, I guess, due to my high level of incompetence, right, coming out of school, it was definitely something that I considered to kind of stay with the institution to learn more about dentistry, right? But bottom line is, if I was to go back, I wouldn't think twice about it again. I would definitely go out and start working. But if you were one of me, who feels like there's got to be more to learn, right? I don't know enough to go out in the real world. But I would definitely go hard on researching what the curriculum provides, right? What you will be doing for the year that you're there. And if it's right for you, then yeah, go for it, because I feel like you're still, under the big, umbrella of, somebody who's helping you. You have your, what do they call you? The faculty, the doctor that's on site that's helping attending, right? So you'll definitely get more education there as well. But like I say, if I go back, if I went back, and I would probably start working again, because in a year time under the right mentorship, you will definitely get a lot more out of that 1 year experience than you would in the GPR, for me at least. But from my friends as well who's done the residency, you learn some cool stuff too that you wouldn't, right? Like apnea, like that's not an everyday thing for us. It was something that we just implemented last year and a half or so. So like you'll come out with that education too, right? And other aspects of dentistry. I'm sure they'll do some other things that you really weren't familiar with our curriculum in NYU and other schools. So yeah, definitely do a lot of research. Like I said, ask a lot of questions. But I personally think it'll be fine either way. It's at the end of the day, it's just 1 year. I don't think it's gonna make a whole lot of difference. But yeah, go with what floats your boat, really.
So I didn't do GPR, so my take on GPR is going to be a little subjective. But according to what I heard from my friends who did GPR, was that it's very program selective and program dependent. So some of the programs will prepare you well to go out to the real world, but the other one's going to be, as my friends quoted, waste of time. So you want to do some research. And I think it comes down to who you are and how motivated you are. So if you're not sure what you want to do, or if you want to stay in New York for a little more, or if you're thinking about practicing in New York City, then GPR is going to be the right choice for you. But if you are motivated that you want to become a GP and you're going to take every opportunities to become one, then GP is going to be the right choice. So do some research, and yep, that's my recommendation.
So my message for the GPR would be that if you are going to be working in a hospital setting in the future, or if you'd like to start with a slow pace, in that way, I would definitely recommend the GPR. For my class, we lost 1 year because of the COVID, and a lot of our colleagues didn't have the confidence. So a lot of them actually went for the GPR. So I asked them a lot of questions. And per day, they told me that they see about 4 to 8 patients a day. If you're at the outside, in the real world dentistry, you will be able to see a lot more patients. You can see up to like 20, 30. So in terms of the amount of the experience wise, you will be able to get a lot more as a GP outside. So I would recommend you to get the GPR if you'd like. But some people, they like to start slowly. So that's totally fine. Everyone's a little different. So if you feel like you'd like to start with a slow setting, or if you feel like you're going to be working in the hospital setting, I'd definitely recommend the GPR. But if you'd like to get as much experience as possible in a short time, maybe practicing as a GP outside is not bad at all.
For me, not choosing the GPR was I wanted to get out in the real world as fast as I can so I can start earning. That was the first. And then I wanted to have the flexibility and the choice of choosing whatever course I wanted to do as I progressed in with my skill in the clinical setting. So I just was very focused on not doing it from the beginning. So I never even thought about it. Listening to these guys, and I don't think any one way or the other is right. It is exactly what you focus on and what your priorities are, what you want to do after. Do you want to earn right away and start making a living? Some people are married, have kids, they have responsibilities. Some people are younger, they have more time. It depends on a lot of things, and you have to decide for yourself. Like I said, your friends might be doing a lot of different things, and it might be a hype for something. Just don't fall into that trap. See what you want to do. See really what you want to do, because in the end, it's just you who's responsible for yourself.
You know, with GPR, I'm just going to say one thing only is if you guys decide to do GPR, which is absolutely great, just make sure you have like extreme good work ethics. Finish the program. Because time after time, I keep hearing like somebody started GPR and then they quit mid-season or whatever the reason is because it was not entertaining. Make sure that when you guys are in that program, it's 110%. If you guys are out in the job, in the field, it's 110%. It's not the program so much, it's just making sure whatever you get yourself in, remember what I told you. Once you get in a program, it's a decision you made in the past. Live it. It's easy to make a commitment, but it's extremely hard to keep that commitment. And once when you do stick to that commitment and you do finish it up with excellent work ethics, you guys will be on top of the game anywhere you go. All right, the next one is specialty. You know, we have a lot of colleagues that would specialize in ortho, in perio, oral surgery, endo. What is your specific take on why somebody should be specializing and why somebody should not be specializing?
Yeah, I have to go first. I think this really will boil down to personality type and dedication to like what you want to do, what you see yourself doing. My friends that did specialize either were not very good at general dentistry in school and they knew that right away about themselves, or that they couldn't feel the fulfillment of doing it and they wanted to find their passion and track in some other avenue. The other, I think, interesting thing about like being outside now and having gone to CEs and symposiums and listening to the specialist lectures is kind of, when you hear them talk about these things, they're very detail-oriented, they're very focused, but they're also kind of tackling the extremes. They're not doing the easy stuff, they're doing the extremes. So when you go to learn as a general dentist and be a super general dentist from these specialists, you're trying to kind of emulate what they do to the standard they're doing. And a lot of these specialists are doing very, very complicated revisions of messed up implants or going into the sinus and doing lifting. And like, this is not commonplace, but it's what they're willing to do. So there's kind of like a fulfillment and almost being borderline a daredevil in dentistry. And I think, you know, as none of us are specialists, but we try to offer a wide array and selection of what we do to the same quality and caliber of a specialist. I think the split in the road will come down to you. And it will come down to, do you want to be the person who is very focused, detailed on a few items on the menu, so to speak? Or do you want to be a jack of all trades and try to help as many people as possible? And that was kind of what my decision was, is kind of just be the latter and not the former. So.
For me, specialty, I think I'm all for it, right? And I say that because I didn't have the luxury of knowing that I wanted to do something specific, right? Out of school, so I was always kind of questioning, like, how would this be? How would that be? Like with all specialties, right? But just like Dr. Kang said, after a couple of years of struggle, and even within the first struggle during the first couple of years, I'm like, I can't do this anymore. Right? I'm gonna specialize. I'm gonna go back to school. But then I stuck to it. I ended up sticking to it, and then I changed my mindset to become a super GP because I'm the type of person that want to do everything and actually do everything well, right? It doesn't mean that I don't have cases that I don't refer, right? You have to know the scope of your skills, right? And you have to know when to refer, and you have to know when to kind of go for it, right? And it also goes without saying, not all specialists are great, right? Not all of them are good at what they do, right? Because you'll see some of their work, surgeons, perios, endos, and it just literally makes you question, like, I could have done better than that, right? Stuff like that, right? And not all GPs are not good at all the things, all the procedures that specialists do, right? It really depends on, the amount of work that you want to put in to learning those things and actually execute them. So I'm all for it. If I go back, I keep saying I want to go back. I would definitely, maybe look into it for sure. But I didn't have, like I said, the luxury of knowing it, while in dental school. And now I'm just like, just want to do everything, right? But if you have a passion, in a specialty, we all want to do GP because we love every aspect of dentistry, like every single, maybe not peds, but so much for me. But yeah, but I do see kids too. So if you know what you want, if you know what you're passionate about, I definitely want to push you to do it. Definitely. So ask yourselves.
So if you're for sure that you want to do one specific thing, then specializing is I guess that's the path you should walk. But if you're like me, who likes to do all variety of things in dentistry and loves treating patients as comprehensive as I can, I think GP is going to be the right choice for you. I love the fact that I can treat my patient who needs an extraction, an implant, to seeing her grandma who needs dentures and seeing her grandchild who needs pulpotomies. Just, I guess it thrills me to see such a wide scope of practice that I can provide.
So my take on the GPs, not the GP specialty, is that if it's like a choice, if you feel like you really like this field and you just want to dive into it, then you should. Of course, you need the grade for it, but if you want to do it, you should. But me personally, like, I have a brother who is working as a dentist, and I asked him about the specialty because I kind of wanted to go for the perio, but he told me that why would you go for the perio for 2 and 3 years? I mean, you will be able to learn a lot more in depth, but things like the things the perios do, things like the GBR or things like the implants, those things you can do them as a GP, and at the same time you can learn other stuff at the same time, like endos, prostos. You can build your experience all thoroughly as a GP. It's not going to be as much in depth as the specialty, but I just wanted to have a little bit taste of everything. So that's why I didn't go for the specialty. If I wasn't that interested in perio, so that's why. So if you're really interested in one topic, you should. But if you just want to be all rounder, and that way GP is not a bad choice.
We chose not to do a specialty. It was like an idea from the beginning. We never thought of doing like a specialty. Also because of the communities that we serve, they're coming from all walks of life, and we wanted to have like a family dentistry style practice. That's why we have it, and we actually make specialists out of our associates because each one of them have some kind of skill, and they're really good at one skill. Like Dr. Ru, I send him all my third molar extractions, and patients are okay to travel 3 hours to him to see those crazy surgical extractions. Like, he's a general dentist, but he's really good at that. Dr. Shore does a lot of all on fours, even though he's not with us now. But when he was, I would send my patients there because he is really good at it. So does he really want to do a specialty? I don't think so. He's, like I said, there are like a lot of really good courses that you can go out after you really know what you want to do, and pick and choose from there and make your own practice around it and what your community is like. Depends on that too.
yeah, definitely specialize in only for the love of the game. Like what you like to do, just specialize in that. If you like to do oral surgery and all aspects of oral surgery, tackling all the hard cases, definitely should go into it. But one of the reasons we brought this question up is because I have a lot of friends and colleagues, endodontist and periodontist. And now they are to a point after 10 years of practice, they don't want to do dentistry anymore. They just go like, it's boring. They've been in the field for way too long. And I'm giving a perspective like somebody who graduated back in 2005, and they've been like a periodontist and an endodontist for almost their whole career. So now they came to a point they're burnt out. They don't want to do it anymore because it's not paying off. So like I said, it comes back to work ethics, right? If you guys are going to be in 110%. And for me, my specialty is what do I do with my doctors? That's my passion. That's my specialty. And what do I do with implantology? What do I do with surgical extractions? What do I do with a lot of procedures that we do? So in our offices, when we do like lateral sinus lifts, we do, abicals. And now Dr. Shore, he just took a course on remote anchorage with, pterygoids and zygos. So those are the kind of things where you can definitely do them as GPs. But the question is, how much are you willing to extend yourself, right? And just do it for the love of the game. That's it. And it will be so much more rewarding that it's like you guys are not going to work anymore. It's more about passion that you guys are doing. Because eventually, if you guys are going to go to work with this daily mindset that, oh, shoot, I need a vacation, I'm burning out, I need to take a break, I need to take time off, that means it's a red sign, it's a red flag that that thing is not working out for you. Cool? All right, let's come back to contracts, right? When reviewing contracts and agreements, what are some of the red flags that you guys saw? Okay? And also in an agreement, what does base pay mean to you?
I have a lot of experience with this one, unfortunately. So I was fed quite a bit of bad contracts. The first thing I would tell you to look for, and Dr. Joffrey nailed this one, is how are they paying you? They're going to throw big percentages and big words at you, like 40% of collections. Then you have to turn around and ask the person who gave you that contract, well, what are you collecting? Are you collecting at 80%, 70%, 100%? How often do I get paid? A lot of those collections offices will pay you once a month. Are you the person who likes to get paid once a month? Because I don't think any of us like to get paid once a month. It's pretty stressful with the bills that stack up in our lives. So like compensation is a big one. If you maybe find yourself in a position where the job didn't work out for whatever reason, you need to look at termination clauses and non-compete. So like non-compete, you don't want to work in an area where you really want to live and you really want to settle down and you really want to raise a family. But then all of a sudden you look in your contract and you overlook the fact that you can't work in a practice 25 miles away from where you just were in a total circle for the next 5 years. So that's another great one to look at. The base pay thing, and this is going to come down to gaining patience, gaining confidence, gaining skill, and ability to produce. Base pay should merely, you should look at that a year later and be like, I don't even work that low ever. So if you are going to be on a production-based pay, the more you do, the more you get paid, right? The better or the more robust your schedule is and the more advanced your procedures you're doing, you're going to blow that out of the water every single day when you walk in there. Dr. Rube blows his out of the water by 10 a.m. and we start at 9. So it's one of those things where you'll in time look at that base pay and just push it to the side. That's rainy day stuff. But it all does come with self-confidence, what you're doing, and your ability to push through it. And the right deal is everything. You don't want it to be like you have to give 5 months written notice before you quit. It's like, well, now you got to work at a job for 5 months and they're going to start weaning off your schedule and tapering it out and you're going to be sitting there suffering. So you want to make sure the non-competes are right, your pay is most right. If there's any benefits, like maybe, insurance or other things like that, just look through it. And my biggest and best advice is find a friend who's an attorney and have them look at it for you because we do not know any of this stuff. They do. So there are tricky words and tricky people out there, and make sure that it's not just your eyes, it's your eyes and someone else's.
Yeah, that. No, just kidding. I actually don't want to tame that because you should literally take everything that he said about contracts. You do want to and read it, review it carefully, read every page, right? We hate those terms and condition kind of deal, right? But read it because it's your life, right? Read every page, review it. If you have an attorney, I would definitely recommend that. But I do have something to say about base pay, right? I'm 6 years out now. I still have friends who are just doing minimal. Like it's crazy the people that I graduated with. But to each their own, right? But they're happy about it. So who am I to judge, literally? But I think it should only be an allowance, right, or kind of form of insurance that your employer provides for you in unforeseen circumstances where they can't like provide an environment for you to produce, right? And then they are responsible for your bare minimum, right? Um, so having said that, you having insurance, you should always reach for the sky. I feel like they can attest to this, and he has a pretty generous minimum, and I have yet to this day in the past 6 years went below that, even during COVID. And yeah, I worked all through COVID, by the way, him and I just. Um, so it's really up to you, right? So it depends on what you do and how the mentality that you bring in each day, and to look at your schedule ahead of time and knowing what you're gonna do that day. So it's for us here. It's pretty meaningless when it comes to base pay. You guys will do far great, and I hope it's a non-factor for you guys when you start working, when you go over your contract. So get it done.
So for me, the red flags were the same thing: the average, higher than the average base pay, and having signing bonus. There's always a reason why they're there. You want to do some research and talk to the upperclassmates who are working there and get some insights. Signing bonus, sometimes they have attached clause to it, so you want to read through carefully. And the base pay didn't really mean a lot to me because I knew I was going to make more than the base pay. So I think that base pay kind of creates this wrong mentality in the newly grads. You should always strive to produce more than the base pay. I think that's all.
So in terms, it's like my answer would be the summary of their answers. If rather than the base pay, pay does not mean too much to me. Rather, I'd advise you to look for the percentage of the commission, or just try to look for is it based on the collection or is it based on the production. I wouldn't really recommend you to focus on the base pay because you are going to exceed it anyway. So that's a good thing. And about the red flag about the contract is that if something looks too bad, to not sign it. If something looks too good, to not sign it. There has to be the reason why it's too good. It's either people are not going there. I'm like, it literally is. I've heard a lot of stories about people getting signing bonus for 50K, 100K. But then when they go there, the owners tell them that, oh, the things only you can do is filling, crown, and easy extractions. And rest of them, like things like the root canal, hard surgical extractions, implants, they don't let you do it for 2 or 3 years. And if you'd like to stick to those bread and butter dentistry, totally fine. But if you wish to do something outside of the scope, in that way, like after a year or two, you try to quit, but then they're like, oh, you have to, you got the signing bonus, what you're gonna do? So then in that way, you are stuck. So if I were you, I'd try to look for some long-term beneficial contract if you can.
So our contract is written by me and Dr. Liu, and it's very easy just because of the fact of these crazy things. When Dr. Liu, he graduated 2007, and I did it in 11. Till 11, there was no concept of sign-up bonuses. The sign-up bonuses came after that because there was a lot of DSOs coming out, and now they have to attract a lot of kids, right? So sign-up bonuses came along, and then we started hearing all these horror stories of how 60,000 is given up, but you cannot break the contract. And if you do break the contract, now you have to give them that back. So be very careful. I've seen some of them myself when some of the associates came up and they couldn't come to our organization because they had signed this. And those tiny little lines right at the end are very important for you to read if you are reading these sign a bonus contracts. They're very tricky. The second one, like Dr. Shore said, I've seen that become a real problem is the restrictive covenant. So like he said, 26, me and Dr. Lou, we had a 26-mile radius of restrictive covenant. So when we wanted to make our own practice and we wanted to come out of our area, we were in the cornfields. There was nothing. We had a choice to come to downtown Chicago or go all the way in one of the really back suburbs because 26 miles was quite a bit for them. So we didn't realize at that time. So you want to be careful in reading all those and negotiate it really well. Base pay is, if you're shooting for the base pay and your eyes are looking at that base pay, you're shooting way too low for your life. You're not worth that base pay. You're more than that. That handpiece in you, like I keep coming back to that, you have to make more than the base pay. New York teaches you really well. You know, they teach you really, really good skills. So have confidence in yourself. That base pay is just for those rainy days when the owner is not, then we have to shut down the office because let's say there was a snowy day or something like that. It's just a blanket, but regular dentistry shouldn't be guided by that base pay. If the place is good, you're gonna make the money.
Yeah, so our contract used to be, I don't even call it a contract, I call it an agreement because there's a difference between those two, right? So contract, if you see somebody having a contract, the word contract, it's usually gonna be like tying you in for like a year, 2 years, or 3 years, depending on how long that term is. An agreement is a little bit less harsh than a word contract. Just make sure you have those two differentiation in mind. Because with an agreement, you can actually put a notice and you can still get out, okay? So when our attorneys made the agreement for us, it was a 20-page agreement. You know, we had it, and slowly over the years, I started watering it down. It came down to 15, then it came down to 10, then it came down to 7. I used to call out my attorney. I was like, you know, what the hell, man? Let's make this shorter. He's like, no, you don't want to do that. You want to have all these clauses inside. After fighting with him back and forth, like for the last 5 years, I think, we shrunk it down to 2 pages and 2 pages only, literally. All right? So if you ask any of these guys, you know, once when they sign, I have the agreement, it's tossed in a file, I never even open it. I don't even know what's inside, okay? And this is not taking out of context. I'm telling you the truth. For me and for Dr. Jaffrey here, right, our main asset are our doctors. Our main passion are our doctors, right? It's more about relationships. How do we create that relationship with them? It's not about some darn agreement and some legal jargon that's going to come between me and them. So that's where, you know, I feel so passionate about this, is because today when these guys are here, it's because we asked them, hey, would you like to come up? And they just volunteer. They're like, hey, yeah, I want to come up. Dr. Shore is not with us. He owns his own practice, and he flew out on his own dime. So, you know, this is a kind of relationship that we cherish long term. It's collaboration. It's how do we make each other happy and how do we win together. It's not about like, you know, I'm the employer and I'm going to put you guys down. No, it's not. We're not like that. So know what you're getting into, and remember those two terms, contract and agreement. You guys can Google it and look it up. Contract is a lot more harsher. Okay? All righty, so let's talk about patient communication, right? How do you approach that, and how do you have the patient build trust in you? And how important is communication?
It's key. It's everything. To me, if a person just in a general interaction can tell whether they trust you in probably 5 minutes. And us as dentists, we're the third person they see when they get in the office, right? They've already met the front desk, they've already met the assistant, and now they meet you. So you can either make a really good experience really, really good, or experience okay, and they don't really trust you that much, and they're just going to leave, and everything you told them is going to be in one ear out the other ear. So you really have to be like that empathetic individual that comes in and listens first, right? That's a key. Just always listen to what they're telling you and understand where that person's coming from. And a lot of times I ask, what can I do to help you? And I just let them talk, because you need to understand where that person's coming from in order to treat their needs. It's always that tone that you want to set, that, you know, don't cut them off, let them talk, let it get it all out. Sometimes it can take a while, but just listen and nod your head. And more often than not, that's what builds that relationship. Like, they heard me out, and now we're going to make something that works for you. No two treatment plans you'll make are ever going to be the same. And if you are making the same treatment plan over and over, I suggest you kind of revise the way you think, because by that logic, you're inferring that people are exactly the same. So communication with patients is, I always love being simple and clean. Avoid dental talk. If you start throwing out words like mesial, distal, ulcer, this, they're going to think I'm dying, right? So like, you just got to keep it simple and be like, hey, this tooth needs to have a little work done on it. And we can definitely get you where you want. It's just going to require a little bit of, like, you know, long days and decent appointments. And like, just using, you know, bring yourself down to their level, sitting down and talking to them, not standing with your arms crossed or talking from behind them. Just very simple things you can do, like eye contact, confidence, gesture. It's going to allow the patient to think that you are really not so intimidating, right? Or you're building trust. And it's the small things that you can do over and over and over again, even if you're not that confident, right? Or you don't know what the treatment plan really holds. Like, I had one the other day where I'm like, hey, you know what? This is pretty complicated. I'm going to be honest with you. I'm going to try my best to kind of look at it and take some time, and I'll get back in touch with you. And even just those kind of things, you don't have to act like a know-it-all, but just using common words, being simple, being relatable, most importantly, builds trust. And that's all part of communication. You're way more likely to sell something. Come on, man. You're way more likely to sell something to somebody or have them buy in with you if they just think that you're in it for them. And a lot of that comes from that first interaction. And I mean, a lot of us can definitely say, you don't win them all either. You're not going to get everyone to trust you, and you're most certainly not going to, there's always patients that are just absolutely crazy. I mean, let's be honest. Like, they're going to come in and tell you these crazy things. You're like, I don't really think I want to jump into this. But you being that relatable person, a communicable person, you'll have your filter, and you'll be able to make and do things that work with you and work for the people you want to treat. And I think a lot of it does come down to just interpersonal communication and simple language. And it's something we struggle with as dentists. We think in dentist mode all the time. So it takes time, but you will get there.
Cool. I'm just gonna tag on a few more because he touches on obviously a lot of broad things, and they're definitely all vital. Much better than what I would have to say, probably. No, seriously though. But I do wanna. I have a few key words, right, that I always, try to reiterate in my head before I go into the studio. You have to be honest, right, and you have to empathize, right. And so honesty, empathy, and what I like to call confidence, right, supported by your competence, right. So, and your patients know, right? They're not dumb. They might not know more dentistry than you do, right? But these are all people, and we're treating people. We're not treating teeth, right? And they told us in school they'll remember. They won't necessarily remember what you said, but they'll remember how you made them feel, right? We've heard that over and over again. And your patients will go extra mile to come see you. Like, and I've had patients like they brought it. They'll drive 3 hours. Sorry, not 3 miles. 3 hours to come see you, right? And I've had somebody that came 6 hours from heart of Iowa into Chicago. So they'll come, but so communication is really key. Be honest with them. Don't try to don't fake shit. Like that's me. Like, just say for what it is. You don't want to sound incompetent, right, to the patient, right? But say things for what it is, right? Because they're not dumb, right? They know, but have enough confidence to get your way out of through there, and that happens through communication with the patient, and make sure to listen to them, empathize them. And these are old people, they come in with stories, sometimes they'll have too much stories for you too, right? And it's hard listening to every single one of them sometimes, but They all have stories, so open up your ears, listen to what they really have to say, because that's ultimately how you will close your cases and pretty much deal with them. So yeah.
I think they cover it all. So, listening is the most important part. Show both verbally and non-verbally that you care about what they have to say. Don't face a computer, or like lean forward to them, make some eye contact, and verbally agree with them. And all those like little details that you provide can build some rapport with them. For example, if you see the patient's crying, don't just walk away. Give them some tissues or give a cup of water. I think that's the key for me. Yep.
So in terms of the communication with the patients, I'm still trying to figure it out. But the methods that I'm using these days is that first, when I walk in, when I see the patient, I smile big. Then, no, I do smile big, and then I pretty much explain everything from A to Z. Not just when I go over the X-ray with the patient, I don't just point at the cavity and say this is cavity. I explain to them how the X-rays work. Things like, basically how the X-ray works is anything dense appears as white, anything empty. This is the little dark spots is like nerve chamber, any cavity here, simple filling. But if it goes big, in that way you get the infection on and on. And then after that, I confirm if they understood. I try to use the simple words. Then when I give them the treatment options, I get them as many treatment options as possible, from the most conservative plan to the most aggressive plan. And then I answer their questions. The first appointment takes time, but the only reason why I'm trying to answer all the questions is because from the second appointment, they're not going to ask me any questions. It's kind of saving me time on the second appointment when I'm trying to do the procedures. And when you explain everything to them, I always explain what you need to expect, what kind of result you need to expect. And when we do the work and when the patient gets the result that I explained before, then the patient has the full trust in me and they start to bring their family members. And that's the method that I'm trying to use these days.
I think communication starts from the time you enter the op room and how you enter the op room, right? The patient is watching you really, really carefully because they probably have been sitting in that chair for the last 15, 20 minutes watching the TV, watching the whole environment. And now you're the first person after the dental assistant who walks in, and they're watching you from head to toe, right there. Right there, your communication starts. How you dress up, how your hair are, how you smell, really. And they're starting to make an opinion right there on you, and you're on the spot. So you want to be really mindful of how you enter the op room. If you enter the op room really meek and shy, that's the impression they're going to get, that you're new, right? That you're young. Dr. Che used to get that. But you should watch how she walks in the room. She can get confidence for those full fixed art patients right away. They know what she's doing. So how you walk in the room is really important. And then keeping it really simple. I am in an opinion not to give the patient way too many options and confuse them really bad, because now they're going to say, okay, I'm going to ask my spouse about this. You've lost the patient right there. You give them too many options, they don't know what dentistry is. You're going to tell them crown landing and this and that and that and that, and they're gone. Keep it simple, keep it very low level. Sit eye to eye, take your mask down, take your head loops out, and talk to them and listen to them of what their complaint is. Always end the conversation with their complaint in mind. When you repeat their chief complaint again, they know they were heard and the trust is getting built up. So the trust doesn't get built up just because you have a DDS or NYU or PhD written on that name. The trust gets built up how they perceive you in front of them. Okay?
Well, guys, this was the last question. Give it up for these guys for coming and sharing their knowledge. Just going to open it up a few minutes. Anybody have any questions? Yeah.
So, oh, this one work? Yeah. So, thank you for the amazing discussion. And I do have a quick question about Secure Dental. You guys mentioned about the mentor system within the practice. Would you be able to elaborate more than that? Because is there any like specific curriculum that the new hires can go through to become a better clinician in the clinic?
You guys want to tackle that?
There's a lot of day-to-day stuff we can do, and also long-term. So like long-term, there's educational opportunities like endo courses in-house. We're not going places. Like all of us as a group would meet up in a neutral location, and then those lecturers would come to us. Those are like the out-of-house opportunities. We did one for sleep apnea. We did one for endo. We did one for implant. There's an overdenture one coming up next weekend. So like there's tons of those opportunities. The other ones are going to be like, like we use cloud-based software. So like to lead dentists, we'll be able to, you're like, hey, I need you to look at this. This person's in my chair right now. What would you do? They can see the x-ray. They can give you ideas. So there's remote opportunity if they're not next to you. If you have a bigger case, I'm sure, sometimes we put in our doctor's WhatsApp, you'll hear 15 different opinions. But I'm going to turn it over to them.
For me, let's see. I think it's the good in this. So what's good about them is they'll gear it towards you, right? So it'll depend. So we'll have our thing, right? So Dr. Lou and Joffrey will have their thing that they want to do and share with us, right? So they'll kind of set up courses for us with maybe some of our interest. So like we'll have our in-house thing, like Dr. Short said, but they'll gear it towards you too. Let's say if you have more things that you want to learn about, if you're interested in something, and they're very well aware that we're all different, right? So we're not all the same. We're not all interested in the same procedures. So I think that's what's good. So the word opportunity is there, right? They'll listen to you. One of the big things that was a big plus for me with this company was true implant autonomy, right? And procedural autonomy, right? And actually being able to do different things, right? And there were many, many procedures where I was very hesitant to do in the beginning, very reluctant, and I brought it up to Dr. Lou and Joffrey and was like, hey, this. Like, yeah, man, go for it, man. Like that kind of mentality, it pushes you, they push you, and then they want you to do what you want to do. So I think in that sense, I would like to use the word opportunity. So if there's something that you want to learn, they'll rarely say no unless you want to go out there and kill somebody. Yeah, just make it your own.
I just want to add on. I think your question was if somebody starts, right?
For the new hires.
Right. So if somebody starts, right? So here's my thing. We bring them down to our main office, which is East Peoria, right? We are there with them for a few weeks. All we're doing is just recalibrating how they think, basically. Everybody knows dentistry. Everybody knows how to do a class 2, knows how to do a crown prep. So we are spending time basically on metrics, KPIs, on our spreadsheet, which they know very well about. Okay, so we are looking at targets, goals. We are looking at basically how do you treatment plan to be successful? How do you treatment plan to make sure you're not under your base pay, right? We want to make sure we go over the CDT codes. What's legal, ethical, and moral? How to swing for the fences without getting in trouble. Where is a red line zone, right? How do you operate in a gray zone? So those are the kind of things, how to be like productive, how to be ethical, and how to be fast and efficient. What are some of the do's and the don'ts? So it's like the weeks that we spend together, it's not like a certain curriculum, but it's all over the place because everyone coming in is different. And we just have to kind of tailor it according to what that individual is. But we all, after that, then we have our monthly doctors meeting that we do on Zoom. And I highly recommend everybody, and everybody shows up. And then we have our WhatsApp group. That's when anybody who's gotten into some sort of a trouble, and we just put it up there. And somebody can elaborate. If, let's say, if I'm busy in a meeting, or if she's busy, then any one of these guys can go in there and just put in an answer. Hey, this is how you do it, right? So the support system is there. And then, of course, we have another WhatsApp group where we have Dr. Bruno, who is with our implant guy. And he does all the educational component for Strawman. And he is literally in our speed dial, believe it or not. right? So that's huge. And then we have Dr. Luciana right now from ClearCorrect. And that is a huge opportunity because now we are doing ClearCorrect treatment, which is AKA like, the competition of Invisalign. And now she is walking through all the steps on what to do and what not to do. And, that lady is on a speed dial. Okay, so the help is out there. It's just about how much do you want to learn and how much do you want to dive in. Okay, the platform is there. Any other questions? We good? Yes.
I'm a D1 student and I'm actually considering the HPSP program from the Army. And I worked as assistant before I come to here, and that dentist said come back after graduating and he will gonna teach me how to do the implants and sinus lifting, all that. If you were in my position, what would be your choice going like right after the graduation, going back to that dentist and learning those opportunity, or thinking about the DAP and going into the Army for 3 years?
So is it like you have a choice right now that you don't have to go back to the army, or is it you do have a choice?
Yeah, I have choice. I am in process of applying, so I haven't committed yet. I haven't got any scholarship from them yet. So
What are you, Dr. Sting?
I want to ask, return a question for you. What's like your main reason, I guess, per se, for applying for the program? Like, what are you
for
in
the
it for?
scholarship program,
Yeah,
it mainly is the DAP.
money, right?
Yeah.
If you're in it for money, I say no. You'll make the money back in 3 years. If your mind is there, if your heart is there, for me, I think you'll learn a lot more. So one of the things that my friends who are in the same program struggle with, and I can't speak for them because I know I wasn't on it, but according to their experience, I got a lot of GPR vibes kind of experience where they don't get to do a lot. I've had some of my friends were just doing amalgam fillings for like their first year and see like 4 to 5 patients. Like that's crazy to me, right? But if that is something that's gonna really scare you off, then I guess you gotta do you, right? But if money is the sole factor for you, I say you have more than enough potential to come out. 3 years? What is it? 4 years?
If I apply now, it's 3 years.
It's 3 years post graduation. Yeah, from personal experience, you'll make that money back with a lot more experience. Okay.
I have a few friends that actually did that exact same thing, where it wasn't the 4 and you signed prior to dental school. They did the 3 for 3, and I can pretty much speak on behalf of the fact that they didn't do a whole lot. They spent a lot of time sitting around doing fillings and exams, and one of my friends is trying to open his own office, and he is having a very tough time like understanding real world dentistry. When they release you back in as a civilian, right, is what they call us. You're struggling to do what all of us do so well, and it's like I've even had to tell them like how insurance works. So it's a massive. You're not just going into academia. You're going into academia and the government style of that. So there's a pro and a con there, right? The money's great. If you want to make a career out of it, then absolutely do it. But that involves 20 years of service, and then you get your retirement and all the benefits after that. It goes both ways. If you really see yourself doing it, they will pay for residencies, but then it's your 3 years plus 4 years of residency, which means now you owe them 8 or 7. And it might not be that easy to get after that because now you're 4 years away from getting that 20, and it might dictate or change the course of your career. It's really one of those things, look inside, where do you want to be in 10 years? Because if you're serving them 3, you're in for 3. If they get you to do a residency in there, now all of a sudden you're in for 10, 7. And it's just one of those things. If you want to talk to me more about this after, I can possibly offer up a few more things because we also have a naval base up in Chicago. So I've ran into a few of those dentists just along the circuit and asked them kind of their things. And a lot of them stay on and they want to do the 20. So there's hot and cold, there's extreme there. But Dr. Rue nailed it. 3 good years of work, you won't even look back and say the loan. And you could stagger this stuff out. Real world stuff, you'll meet with a financial planner the day you graduate, and they'll break it up like, hey, let's refinance this over 19 years. And then you got a credit card payment for 19 years. Or let's pull your high interest loans out and make them low interest loans. Like, it's right now, it's a big number with no plan. But when you graduate, you get ways to break it up. You can go private bank, you can leave some in the federal government or whatever your loan situation is, whether that just don't overreact too early on, because that's what we probably all did as well. So
your time's worth more, I would say. Yeah, it's definitely more valuable, right? If you go in, right, like let's say you graduate, you went in, you like the program, great, right? That's the best. But let's say, right, you're 1-2 months in, and you're like, shit, it's not for me. But now you're bound to them for 3 years, right? So the freedom too, I think, right? And you're always gonna be in debt, man. Like, yeah, but it's good debt though, right? So I wouldn't let that be a factor, right? I wouldn't let money. If you do good dentistry, and I tell this to everybody, the money will follow. Yeah.
You said the doctor is willing to mentor you, right? I think that's, for me, if I had that choice, I would take it, because that mentorship is going to have you ground running than the other choice, because there you're just doing regular dentistry for 3, 4, 5 years and you're stuck and you're bound, where this mentor is ready to mentor you, and you'll learn so much more that you're going to make more money anyway selling those cases, right? So you don't have to look back to that other choice. That's really how I would look at it, because there are very few mentors that say that.
Anybody else?
Yeah.
Get out.
So it's going to come down to a few things. The first job was the first thing. All of us were in the same spot, right? So we were placing single unit implants with confidence. And it's not like you're going to walk in day one and all on 4 immediate load, print the temp, like that's not realistic. You have to, walk before you run. And with us, Dr. Rue's done plenty of that stuff. And I have no doubt that these other doctors and all of our other doctors are going to do it eventually, because it just comes with repetition. The story that I have is when Dr. Rue and I started with Dr. Joffrey and Dr. Liu, it was you had to go get a certification to place implants with us, because we didn't have this huge educational support at that point. We were a lot smaller and we grew. So with us, we went out and I took my whole first year's earnings, all of it, anything in savings, and invested right back into implant education. So it's not free. It's definitely not cheap, but it was value of time. Like, I could do general dentistry, I could have a job, I could make money, and on the weekends, I could go do it correctly, learn from the best, learn from the procedural, and the recent remote anchorage course I took was by a general dentist who does tons of that stuff, and an oral surgeon. Now, that oral surgeon at that course said, you know what we stink at that you guys rock at? And I go, what? He has teeth, right? So the thing that you have to understand as a general is you get to do everything. Now, if you go specialize, you are the person who's placing the implants, but you have no business touching those teeth. So you might not get to do to the level of someone who is a super GP. You can design the teeth. You can design the position of the implants and the multi-units. You control every aspect that you're comfortable with. And that's something that I would encourage if you really want to see yourself doing. And that's a huge market trend right now, right? I mean, we're all seeing these centers open up. We're all seeing it happen. And in those centers, like, I don't know if Clear Choice is a big thing out here, but they have teams. You know, you have the surgeon who places the implant and the prosthetist who restores the teeth. It's not one person doing it all. If you really want the full autonomy, then remaining as a general dentist is truly the only way to do it. And I do everything, you know. I do root canals, I do implants, I do veneer, aesthetic, you name it. It's just whatever you want and whatever your skill set requires. And it's nothing short of investing in yourself and going out and grabbing those trainings and doing your research. But you don't have to specialize to get there. And all 4 of us, 5 of us are testaments to that. Like, you can have the best of both worlds. It just involves work ethic. And I'll turn it over to Dr. Rue because he's done plenty just as much as I have.
Yeah, I'm not gonna talk about like clinical stuff, but as long as your ultimate goal is there, right? And I think one of the beauty about dentistry is there are so many different ways to get there, right? So as long as you have something that you want to do, I don't care if you're a GP, I don't care if you're OS, ortho, even, you know, I've seen orthos place implants, crazy, right? So as long as you have, you know what you want to do, the different paths to get there, right? At the end of the day, you're gonna have to pay to learn, right? I think one of the lucks of being a specialist is that you do very focused education, right? So in that sense, I think it's better. But there's nothing that you won't be able to do, even if you just went out there and started working. But just kind of do your own research and studies. And there's so many courses out there. They'll essentially so both pros and cons, all right? Hence the life, right? So what's good about being focused education, being specializing, is you'll be obviously much better. You have a much stronger base, right, at what you do and what you know, right? Whereas if you're a general practitioner, you kind of go around that, right? So it's good in the sense that you'll get the meat of it, right? You might not have to deal with extra didactics, having to write a paper and do all that to get your master's, right? If you do go into residency, so you'll get the meat of it, but you may not get all of what you want, right? That you will learn as a specialist. So you kind of have to weigh that yourself. Okay.
Anybody else? Yeah.
Hello. Anyway, thank you again. Slushy Saturday. I'm a D4. Graduation on the horizon. What to do.
That's great.
So right now we're in Illinois, Northwest Indiana, the Quad Cities, and right now we are expanding into Tennessee, but nowhere near East Coast. Correct. Tennessee and Nashville. So that's where our next market is, and it's a great city. But I like it that you already have a plan, and I like the fact that you already know what you're doing and where you're gonna go. So that's awesome. Yeah. Dr. Ru does. He goes for massages.
Yeah, you'll find yourself just like this all day long. So yeah, I would recommend it. And I was recommended by my peers and do yoga and stuff like that, but it's not for me. So I'm trying to find my own ways to get some form of stretching, like therapy, chiro, stuff like that. So I'm not like the older, like Dr. Gill, right? That's my guy. I love him. Yeah, you'll be a good reminder for me. Like after coming out, my neck will be sore, shoulders. So I think it's good if you find a routine to get those things in, you can do more of what you love.
we all have in common over here is you got to understand one thing. Your physical activity has to be part of your normal lifestyle. And that is one of those things we all live by and abide by. If you want to be successful, like truly successful, your physique, your physical activity has to be right up there with even your career, your professional life, your personal life, and your financial life, right? Because oftentimes we see that we are really killing it in professional. We are great dentists, right? We are doing a lot of things there. But when it comes to health, we're eating the wrong stuff. We're not working out, we're not exercising. So as long as you kind of keep that up, lower back pain, neck pain that dentists have, right? It's all a myth. Trust me on this. We practice, full time. And all these guys can attest by it, that we all live by the same rule that your physical activity is a must. So, great question. Anybody else? All right, cool. So if nobody else, let's call it, let's give them a big applaud there. Thanks, guys.